Bismillah ar-Rahman ar-Rahim, my dear vascular colleague, another lecture of the series of how to master vascular surgery, lecture number 11. This lecture is titled How to be a Safe Vascular Consultant. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon. Being safe vascular consultant is a must. One of the worst criteria of vascular surgeon is to be unsafe. It is more important than being a speedy surgeon. And this experience of safety does not come by nature. It comes by discipline. So being a safe surgeon, extremely important. It will show you among your colleagues, among your patient, and even in your hospital, if you are a safe surgeon or not. It shows quite obviously. It is extremely important in your career to be a safe surgeon. You always learn from your mistakes, and this takes a lot of experience to learn from it. But there is a technique that I will summarize in this lecture. Definitely, there are many rules to be a safe surgeon. I will discuss, let us say, the commonest 5 of them, but there are plenty that I will cover accordingly. So, the first or the best 5 rules that I think are helpful in your career is, in my opinion, rule number 1 is hard work. There is no safe surgeon that I have seen which did not spend plenty of time learning techniques, learning knowledge, asking a colleague. So hard work is a must. Both reading and manual practice and training courses and workshops, and discuss it with your colleague. You need to pass a certain exam in order to be safe surgeon. You can't be safe surgeon while you are failing your FRCS or European board. So you need to pass certain exam, and we all know this exam, the MRCS Part 1, Part 2, FRCS exam, the exit exam, European board, and there are many courses across the way. You must be fully prepared for this exam. And this will save you a lot of time and will increase your safety. So hard work is extremely important. Resetting an exam is demoralizing, and I wouldn't advise. I have some of my colleagues, they pay the money, the fees for the exam, hoping that when they pay the money, they start studying hard. This doesn't work. If you are not prepared fully for the exam, don't pay the fees to go to this exam. And let us also other example of my colleagues say, well, the first time, let me know how the exam works. So he knows that he is going to fail the exam before he goes in. This is very bad, because it's not only it wasting your time, but it will be demoralizing when you start going second time and third time. There are exceptions. We all remember Professor Slaney, which became the president of the Royal College of Surgeons of England, and he failed the first part of FRCS, I think about 13 times. But this is an exception and not the rule. So work hard, prepare your exam is a must, and I think this is rule number 1. And this goes with الحديث الصحيح عن سيدنا رسول الله صلى الله عليه وسلم إن الله تعالى يحب إذا عمل أحدكم عملا أن يتقنه. So this means in English that this is the prophet. He mentioned that God like your work to be near perfection as much as you can. So this is rule number 1. Secondly, you need to read smartly. You don't need to read everything, but you read smartly. And one of the very nice books that I would advise you to read is the landmark paper, the best 50 landmark paper. It's in multiple specialty. It is in plastic, in general surgery, in GIT, and in vascular. So you don't need to read everything, but let us say you have to read very well the landmark paper, which comes every year. And it summarizes to you what is the important paper to read. And this you will find in the Vascular Online Training Digital Library. reading is an essential. There is an essential. You must cope with the new knowledge. It is an essential part of your duty, and this will help your safety, because you have to remember that in order to see a mistake, you must know that mistake is happening. You must have seen what has happened before, and knowledge will help you a lot. And this has helped me a lot in my career. And this is the book I would advise you to read. Rule number 3, you must know very well what we call bread and butter vascular procedure. Bread and butter vascular procedure is a procedure that you must know them by heart. Open aortic repair, carotid endarterectomy, common femoral endarterectomy, femoral above knee popliteal bypass, fem-pop above knee, fem-pop below knee, fem-distal bypass, femoral embolectomy, popliteal embolectomy, brachial embolectomy, lower limb fasciotomy, hallux amputation, foot debridement. I have collected, let us say, the best bread and butter, the best 15 to 20 procedures. Transmetatarsal, above knee amputation, below knee amputation, guillotine amputation, which is sometimes you need to do in the ICU. Great saphenous vein endovenous ablation, now standard practice. Saphenofemoral junction ligation, temporal artery biopsy, brachiocephalic fistula creation, and peritoneal dialysis tube insertion. These are the bread and butter procedures that you don't have any excuse not to perform them well. And also peritoneal dialysis tube removal, you need to know this as well. Rule number 4, you must see your patient every day. Now, we are all committed to consultant-led service. What this means that you are responsible for your patient. If you have senior registrar and house officer, and FY1 and FY2 and SPR, all this does not exclude you from seeing the patient every day. Don't rely on others to do that for you. This is very important. It's a must for any consultant in a consultant-led service hospital that you must see your patient at least once. Not only that, but you need to document in your papers that you have seen him. Rule number 5, you need to write everything and write it very clearly. You need to write the operation very clearly. You need to write the word round when you go and pass and see a patient. You must write in the notes everything that you have done. If something that is not written, it has not been done. Again, mention the complication clearly. Patient developed hematoma, developed wound infection on the following day, and this is your plan of management. There is a system when you write medical notes, which is called the SWAP system. So you see symptomatology, then objectively, then you need to do assessment and plan. You call it SWAP. You need to write it at least 4 lines, and you need to let your junior to do this as well. So always write in notes. It's always big mistake when you don't write it down what you have done or the patient observation chart. Of course, there are plenty more advices. I will discuss them over the next few lectures. And one of the very nice books that I will recommend you to do is a book that has been issued in 2023 called How to Become a Safe Surgeon. It was a very nice book, How to Become a Safe Vascular Surgeon, by a very colleague from United Kingdom. He just got his new consultant post, and he wants to summarize his experience. It's a very nice book to read. Again, if you go to Vascular Online Training Digital Library, you can download the book and read it as well. Of course, there are plenty more. I will discuss all tips and tricks of being a safe surgeon. I have learned a lot, and I will try to document it. So my conclusion: being a safe surgeon is an art that you need to develop, and one of the most important criteria is to be a safe surgeon. It's a must, and it is needed, better than being a fast surgeon. I have, across my career, have seen a lot of very quick surgeons, but they are not safe surgeons, and they got a lot of complication. So although being fast is an important criteria, but comes second to being safe vascular surgeon. And this is very important. And there are plenty of rules that you will learn across your career. And this is the reason for this lecture is to summarize, let us say, the best 5 rules in my opinion. Thank you very much. I wish you all the best, and I hope this lecture is of benefit to all my vascular colleagues. With all my best wishes, Dr. Muhammad Omar Al Farouk.